To the first clinical case in the psychiatry tutorials from Medic Workshop. So today we're going to discuss eating disorders, and we're going to do this by talking about a case of a 21-year-old female. She's a biology student and she was found after fainting in the lab. She insists that she's okay, and even though her parents have said that she skipped breakfast, she says she's fine now. She denies any problems sleeping or with her appetite. Although, whilst questioning her, she says that she looks fat and she could do with losing a couple more pounds and then she would be very happy. She reluctantly admits that her periods are less regular than they have been. She had a menarche at 13 and over the past 6 months she's only had 2 periods. She's not sexually active and she's doing very well at university. The obvious next step is to do an examination on her. So what did we find? So on examination, we found that she looked very tired. She also had sunken cheeks. Her clothes were very baggy. Her fingers were tinged blue and they were very cold to touch. She also had fine downy hair on her arms and her BMI was 16.4. So some differentials. Let's try and think about some. So there's a very obvious one which kind of sticks out, and that's anorexia nervosa. Second would be maybe depression, and the third would probably be Crohn's or celiac disease. So no, anorexia nervosa can present to many different clinical specialities and present in many different ways. So what is the diagnostic criteria for anorexia nervosa? So there's 4 things. The first is weight has to be less than 85% of the predicted. The second is you need to have a distorted body image. What this means is you can be very skinny but you think you're fat. And then the third one is you have to have a very intense fear of putting on weight. The fourth is you have weight loss which is so significant it leads to amenorrhea. Amenorrhea is the lack of periods. So, how does anorexia nervosa affect the human body? It affects the human body in many different ways. It can affect the brain, the heart, the lungs. So, it affects the brain. It makes you can't think straight and you be sad and moody. It can also affect the hair. You can have hair loss. You can have many different heart problems and have hypertension. You can have anemic problems and you can have osteoporosis long term. You can also have kidney failure long term. And it usually leads to constipation, amenorrhea, infertility, and stunted growth. So, how do you investigate? You need to take a history from the patient and the family, and albumin levels is usually quite useful in looking at the degree of starvation which the patient has gone under. So, acute treatment. Admit the patient to hospital, they're unlikely to cooperate. Rehydrate, resuscitate, correct electrolytes, and monitor their weight. If the anorexia has been more chronic, then you may have to get an eating disorder team involved. So that was a whistle-stop tour of anorexia nervosa. I hope you found it useful. Obviously there's a few more things I should cover, but that's just a brief overview. Thank you.